شغال. بسم الله الرحمن الرحيم. أولا حقيقة أشكر غرفة الإحساء وشريك الاستراتيجي شركة أرامكو دعوتي لهذا الملتقى، وفي حقيقة واحة المملكة الغناء الأحساء. وشكرا أيضا لمدير الجلسة أبو عبد اللطيف على هذه الاستضافة. الحقيقة يمكن أبغى أبدأ بشكل بسيط عن الإشارة إلى ما تمر فيه الآن وزارة الصحة في ظل رؤية المملكة المباركة 2030 والتحول الصحي الذي تشهده الوزارة في هذا العام. جميع يعلم أنه صدر قرار مقام السامي بإنشاء شركة صحة القابضة العام الماضي، وأيضا هذا التحول له أثره من خلال الاستراتيجية التي عملت في القطاع الصحي، وهي فصل المنظم والمشرع عن مقدم الخدمة. فسيكون اهتمام الوزارة في المرحلة القادمة هو تنظيم ومراقبة أداء الخدمة، وشركة صحة القابضة من خلال التجمعات الصحية لتقديم الخدمات الصحية. هذا جعل أن رحلة التحول تمر في أو لها 3 مكونات رئيسية وأساسية. المكون الأول هي التشريعات والتنظيمات التي صدرت، وهذا أيضا يغطي جانب مهم من هذه الرحلة. الأمر الثاني هو نموذج التشغيل، وهو ما صدر من خلال إنشاء صحة القابضة والتجمعات الصحية في المملكة العربية السعودية. الأمر الثالث أو المحطة الثالثة هو تمويل هذه الخدمات، وهو القرار اللي أيضا صدر من مجلس الوزراء الموقر بمركز التأمين الوطني. فإذا هناك 3 محطات أساسية لرحلة التحول، هي التشريعات والتنظيمات ونموذج تقديم الخدمة وأيضا تمويل هذه الخدمات. هذا جعل أن هناك ممكنات أساسية يتطلب العمل أو دعم هذه الرحلة من 3 مسارات أساسية لدينا. المسار الأول هو حقيقة ديجيتايزيشن أو أتممة العمل أو الخدمة. الأمر الثاني هو الPSP أو مشاركة القطاع الخاص، وهذا أيضا دور كبير جدا، واعتماد حقيقة على القطاع الخاص في أنه يكون شريك حقيقي وواقعي لرحلة التحول وسد الثغرات والفجوات الحقيقة في الخدمات. الأمر الثالث هو الورك فورس أو القوى العاملة أو رأس المال البشري اللي هيعمل على هذا التحول، وأيضا هذا تم مراعاته وصدرت القرارات الخاصة بتطوير هذه القوى البشرية. فمن هذا المنطلق يمكن تكون أساسيات رحلة التحول في القطاع الصحي، والتي نسأل إن شاء الله عز وجل أن يكون رحلة ناجحة وموفقة ومباركة. والحمد لله اليوم بدأنا نلمس بعض ثمرات هذه الرحلة، وكنت يمكن أزف بشرى للإخوان أنه اليوم الحمد لله نحن من خلال مشاركة القطاع الخاص بأول نموذجين حقيقة، مشاركة القطاع الخاص لمستشفى الأنصار في مدينة، وأيضا في الأشعة في الرياض. هذه من المشاريع التي أيضا نعمل عليها كمشاريع تخصيص وفد فجوات للقطاع الصحي في المملكة، ونتج عنها الحمد لله اليوم من خلال هذه الاستراتيجية قرابة 112 مشروع صحي خلال ال4 سنوات القادمة، بتكلفة إجمالية تبلغ تقريبا 48 مليار ريال سعودي. أيضا منطقة الأحساء الحمد لله لها نصيب كبير من هذه المشاريع، سواء من خلال ال3 يعني كاتيجوريز أو مراحل تقديم الخدمات الصحية، سواء مراكز الرعاية الصحية الأولية أو المستشفيات التخصصية. وهناك مشاريع نوعية إن شاء الله حتكون في منطقة الأحساء بإذن الله في خلال الأربع سنوات القادمة. أشكر لكم، وأيضا لعلي يكون إن شاء الله وضعت نبذة بسيطة مختصرة تفسر حقيقة إيش الرحلة اللي إحنا نقوم بها حاليا في التحول الصحي.
إن شاء الله سوف نعود للدكتور إبراهيم بس بعد برزنتيشن لجاد. تفضل.
Okay, can you hear me? Yeah. First, thank you for the organizers for inviting me, and thank you for the participant and Malik. I'm going to take a few minutes and share with you a brief overview of the Saudi healthcare market, some opportunities, some challenges, and what can be done about it. And hopefully we'll discuss some of these topics in our discussion. So, I'll start by sharing some overview of key trends in healthcare that affects the sector in Saudi Arabia. I'll share an overview of the Saudi private sector market, some potential opportunities that exist today from what we heard from a survey of more than 200 investors in the market, and share with you our perspective on some key challenges that hinder private investors in Saudi Arabia and what could be done to improve those. So, to start with the trends, there are 5 global trends influencing the future of healthcare at the global level, but also here in Saudi Arabia, and I'm sure most of you have heard about these. So, as Dr. Ibrahim mentioned before, digital and artificial intelligence are really reshaping the way we think about providing healthcare and delivering services. Genomics and biotechnology are allowing us to move towards more personalized medicine. Robotics, and I'm sure many of you have heard about robotic surgery, allowing surgeons to do a much better job, delivering much better quality and outcomes. Value-based care is basically how we deliver healthcare, so centering it around patient to focus on delivering cost-effective care at high quality. And finally, new models of care, from telemedicine to home care to other modalities to deliver care away from a hospital setting. So these are some of the trends that are influencing healthcare and are reshaping healthcare in Saudi Arabia. On top of these global healthcare, there are some specific things that are happening in the kingdom. So the transformation of the MOH is one of the biggest driver, but also the transformation of the sector. Also, Dr. Ibrahim mentioned this. So the Ministry of Health is trending towards becoming a regulator, shedding away its provider and payer functions. We're seeing an improved readiness and resilience facing future crises. The kingdom did a fantastic job during COVID. We're seeing a further investment in research institutes and centers of excellence. And also, again, as Dr. Ibrahim mentioned, there is a serious desire to further the role of the private sector to contribute to the healthcare sector growth in the kingdom. There is further investment in prevention, in public health management and health security, more investments in developing a skilled and able healthcare workforce, focusing on adopting outcome-driven model of care, not only at the provider level, but some of the payers too. And finally, there are efforts on homogenizing the payer system across the public and private. So taking all of these and coupling them to the global trends are leading to an important role for the private sector. There is a need for the private sector to take its much-ado role in the sector. So one of the national priorities and Vision 2030 is that the private sector participation grows. There is a need for the private sector to contribute to GDP growth, attract foreign direct investment, create job in the sector, but also enable the government to optimize its budget by sharing some of the capital burden, and finally to drive innovation in the healthcare sector, something that the public sector have been limited in doing. So if we look at the private health care sector in the last few years, we can see that a remarkable growth have been witnessed. So you can look at different numbers, not only from a bed perspective, but also percent of the population served, but also the number of hospitals. A lot of the indicators that we share with you here on the slide indicate how the private sector have been growing its share and contributing even further to the healthcare sector, contributing today around 45% of admissions and almost 43% of outpatient visits. Today, it represents 13% of healthcare spending in the kingdom, while at the same time covering almost 32% of the needs of the population. And even in Riyadh, where we think that a lot of investments have happened in the private sector, there are still large pool of underserved region across the kingdom. Even in Riyadh, as you can see on the map, it's still an underserved area given the expected growth in population. So there are many opportunities across the kingdom, but also across the sectors. So if we look at the opportunities for the private sector, there is a need to cater for the growing healthcare demand driven by a significant population growth that is expected, as well as an extensive growth in tourism. There is also an opportunity, as Dr. Ibrahim mentioned, to participate in partnership opportunities with the public sector, which is trying to carve out some of its services to the private sector and is looking for the efficiency, innovation, and agility of the private sector. There are opportunities in investing in life science localization effort, which is an important vector for the kingdom, but also there are many additional segments for growth, like in the new model of care, e-prescription, insurtech, digital tech, telemedicine, and so many other fields. When we interviewed recently more than 200 investors in healthcare, many opportunities were mentioned by these investors. So not only on the payers and provider side, as you can see, but also in startups and digital. So the ability to expand primary care, to invest in digital health, to offer virtual care, the ability to offer some services to the payers, RCMs or TPAs, but also in digital, so everything around health tech, about mental health, around rehab. These are all opportunities that investors have identified. However, there are still some challenges limiting the private sector investment in Saudi Arabia. What we've done is try to map these challenges across the pathway, across the investor journey. So from opportunity identification to market entry, to opportunity enactment, and finally to operation sustainability and growth. And as you can see here, there are challenges across the journey. And we have come up with some recommendations to improve this journey, starting with improving the visibility on market opportunities. As you can see, many investors do not realize the opportunities in the market, the size of these opportunities, where they are, and how they can pursue them. What needs to happen also is to make, reduce the red tape and ease the investor journey, improve predictability. One of the biggest complaints of investors is the rapid changes in laws and regulations and the complication around it. And finally, some market fairness that allows the private sector to be treated in a fair way compared to the public sector. So I think I've taken my time. Thank you very much for the opportunity to share these thoughts with you, and looking forward for the Q&A and the discussion.
مارك قبل ما نروح لمارك دكتور إبراهيم، ممكن تعلق على آخر سلايدز ease of doing business دكتور، إيش عملت الوزارة لتسهيل رحلة المستثمرين؟ لأنه ممكن نحط مستهدفات عظيمة وكبيرة، لكن من غير ما نمكن المستثمرين ما راح تكون الأهداف هذه حقيقة واقعية إنك توصل لها، خصوصاً إنه واضح إن الثيم الرئيسي هي ease of doing business والregulations واللوز اللي الوزارة المفروض تقودها.
شكرا. يمكن ما ادري بس في ايكو، اذا كنت سمعت السؤال صحيح انه ايش الان اللي عملته الوزاره في عمليه تسهيل انفستر جيرني.
بالضبط.
هي حقيقه من ضمن رحله التحول اليوم، زي ما قلنا اليوم رحله التنظيمات والتشريعات والاجراءات او البروسيس، وايضا تطرقنا للتنفيذ. البروسيس مراجعه كل حقيقة الإجراءات المتعلقة والتحديات الخاصة برحلة المستثمر في المجال الصحي اليوم وصلت، ولعله يمكن من أهم اللي عمل خلال العام الماضي ترى عدلت اللائحة الخاصة بالاستثمار الصحي، يمكن 80% منها روجع، وعملت بعض المواد وبعض اللوائح اللي موجودة، واللي كنا يمكن حقيقة مع خلال الشراكة مع القطاع الخاص كان في نقاشات أن هذه تعتبر من الممكنات اللي لازم تعمل وتسهل للقطاع الخاص، وروعيت. وأيضا الأدوات اللائحة اللي كانت في يد الوزارة حقيقة عملت وبصلاحية الوزارة، وأيضا اللي كانت في بعض المواد النظامية اللي لابد أن يكون خلالها من خلال هيئة الخبراء أو المقام السامي عملت. وأيضا يمكن لاحظتوا في الأمر الأخيرة صدرت من المقام السامي بعض التعديلات لمواد النظام في المجال الصحي. هل عملنا كل شيء؟ لا، احنا حقيقة يمكن اليوم الإجراءات والتحول لابد أن يكون فيه تغير وتحول أيضا في الإجراءات يتبعه. إذن التطوير ليس فقط في وجود الفرص، بل أيضا وضع الممكنات اللي تساعد على الاستثمار في القطاع الصحي. اليوم أيضا فيه من خلال العمل مع لجنة التنافسية أو تيسير، وهذا أيضا يضم حقيقة يمكن 50 جهة حكومية. الفترة الماضية يعني أو في الوقت السابق كانت كل جهة تعمل على حدة. اليوم الحمد لله والأمانة من ضمن الأهداف الأساسية واللي شفنا يعني الفائدة والإيجابية فيها في الرؤية، أنه اليوم كل الجهات الحكومية تتوائم على طاولة واحدة. ولا أكون مبالغ إذا قلت في شواهد، وفي شاهد قوي جدا اليوم كلنا مرينا به في الفترة الماضية. وضع كورونا يعني أثبت حقيقة بما لا يدع مجال للشك أنه اليوم التعاون بين والموائمة بين كل الجهات الحكومية كان مضرب مثل، وهذا يمكن وضع الحمد لله المملكة من أصاف الدول العالمية اللي يعتبر نموذج التعامل مع كوفيد وكورونا، نموذج يحتذى به، وهذا يمكن الجميع اطلع عليه ونشر وعرض. فاليوم الإجراءات أيضا تتم وفق الموائمة مع جهات. اليوم المستثمر مثلا في القطاع الصحي يمر بوزارة الشؤون البلدية والقروية، يمر بالدفاع المدني، يمر في وزارة الصحة، يمر في وزارة الاستثمار، يمر في البنوك. هذه هناك منصة إن شاء الله تكون وان ستوب شوب واحدة كلها للمستثمر، وأيضا تكون أتمم، وهذه بإذن الله أنه تكون نعملها خلال 23 ومستهدف 23 بإذن الله. وأيضا تكون هناك جزء يهم التمويل، وهذا حيكون أيضا هناك حقيقة يمكن برامج حنعمل عليها بإذن الله سواء مع صندوق التنمية أو بعض البنوك أيضا للتمويل للمشاريع الصحية. فإجابة سؤالك لطيف، نعم الإجراءات هي هدف أساسي وممكن نعمل عليها بإذن الله حتى يكون هناك سهولة ووضوح في رحلة المستثمر في القطاع الصحي.
شكرا دكتور. Jad, in your presentation you mentioned 23% bed capacity in the private while the admission is 45%. What does it tell you? So you have 25% is the capacity of the bed in the private sector, while the admissions is around 45, right? So it's double the actual capacity, right?
Yes. So some of these numbers definitely have triggered some questions, is how come the private sector is able to deliver this? So one of the hypotheses is that the lighter cases end up in the private sector while the heavier cases end up in the public sector. So that's one hypothesis. The numbers are not there to validate, but also there are definitely some efficiency measures that we can test. So if we look, for example, at the number of visits per GP, per MD in the private sector versus the public sector, we can see a very significant difference.
Jad?
If we look at average lengths of stay, also we can see a difference in the average lengths of stay. So many of these factors contribute to this delta. And I think this is why the Ministry of Health and the government are looking for the private sector to be involved more and more in certain areas, because you can bring this creativity, this innovation, this efficiency to the public sector.
Great, thank you. Mark, let's start.
Thank you, organizers, distinguished delegates, and fellow panelists. My name is Dr. Mark Hyde. I'm here representing the insurance sector. What I want to share with you over the next 5 minutes or so is the perspective from a large payer within the evolving health ecosystem that we see in Saudi Arabia. Oops. Now, needless to say, medical insurance companies play a significant role across the sector. We contribute, in terms of GDP, about 1.3% of total GDP from medical insurance alone. We provide secure access to healthcare for over a third of the population, covering over 10 million people last year. And we've settled about 20 billion in claims going forward. So needless to say, we provide an extreme security net over people across Saudi Arabia. Now, the role of health insurance goes beyond just administrating claims. Really, it is to de-risk and to ensure that there is opportunities for companies, individuals, and investors to be able to go forward with confidence. So we see us as a way to enable the sector to ultimately fulfill their objectives by reducing some of their risk. However, in order for insurance to be a benefit, it needs to be affordable. And we're facing some extreme pressure for one of the first times within the market related to inflation. So medical inflation alone in Saudi Arabia outpaced global benchmarks as well as regional benchmarks. It was estimated mid last year that it would be around 11%, and you can see that that's significantly higher than the GCC average. It actually closed somewhere closer to 13 or 14%. Now that has significant implications, because obviously as the price of insurance goes up, that means SMEs get impacted, large corporates get impacted, projects get impacted, as the cost to provide those benefits actually becomes less affordable going forward. Now, there are obviously counter effects that we're seeing. So Vision 2030 is growing the sector, it's adding new beneficiaries, it's creating more opportunities. We're seeing really dynamic moves from regulators to actually allow insurance companies to take on more accountability for the health and wellness of the people that it serves. In addition to that, there's also a number of financial programs going forward. However, there are some alarming trends. When we actually went out and we surveyed our beneficiaries, our employers, our hospital providers, a number of really critical things came up. One, there is a sentiment that there is wide-scale use of what we call low-value care. So the amount of prescriptions, the amount of treatment, the indications that people are receiving actually may not necessarily all be required. And all of that drives inflation and it drives costs going forward. We've also seen that when employers make decisions about their insurance plans, they don't really see a difference between the big companies. It has become somewhat of a commodity product that is just purely price sensitive. The challenge of that is there creates very little room for innovation if there is constant price pressure, because our margins ultimately contract, and that prevents us from going out and innovating and trying to disrupt the market. But I think the most critical thing is, across the board, from small employers, medium employers, and large employers, They are saying today that the cost of their health insurance is directly impacting their aspirations to grow and to expand, and it also impacts the type of employees that they select when they're hiring for individuals. So elderly people, people with diseases, et cetera, who would drive up the cost of their health plans are being discriminated against, and there's a challenge against bringing them on board. And employers and HR firms are actually really thinking in that way. So we're seeing that the cost of health insurance is actually coming down and really starting to impact decisions. Now, what we try to do at Taunia today is try to reverse what we see as a value-destroying cycle. So I'm sure many of you are aware today, with the insurance that you have, you're able to navigate the system largely how you please. So whatever is in network, you're able to go ahead and do that. Now, the hospitals on the other side are able to be defensive and on indications often overtreat some of their patients. The result of that is we settle those claims, and in subsequent years, the cost of the insurance just goes up. So we're passing that cost essentially to you in the audience as employers, whether it's part of large corporations, SMEs, or smaller entities. We want to try to reverse this cycle. We want to try to build up a more homogeneous level of care. We want to add things around primary care that would be more personalized to provide the guidance, to treat people in a more appropriate setting, to hold providers accountable for delivering high-quality care, and ultimately to make the commitment to say that if you sign up for us as a health insurer, we actually make the commitment that your health will actually get better as a result of that decision. And as a result of that, also fundamentally ensure that our employers get a better benefit. Now, the final slide that I'll share, and there's a couple of other pages, but I'll save some time for discussion, is what specifically are we doing at Taunia in order to reverse these trends? We are trying to create the dynamics that would create aligned incentives between patients, employers, hospital systems, and insurance companies to actually focus on improving the health of individuals at the best possible cost possible. And the way that we're doing that is we are starting to give our patients the insights on which hospital systems actually generate the best results for them. We're starting to look at the variation between different hospital systems. And I'll give you an example. We looked at the top 10 hospitals when it comes to deliveries, the rate of C-sections, so C-sections versus vaginal deliveries. If you look at the UK market, it's about 25%. So the use of C-sections happens only 1 in 4 times. In Saudi Arabia, within the top 10, the highest use of C-section was actually 66%. So 2 out of every 3 deliveries are a C-section. The lowest within that was actually 33%, so only 1 in 3. So if you can imagine, just within the top 10 hospitals alone, there's a 200% variation, and that leads to a tremendous amount of cost over a period of time. So we're looking at that variation, but ultimately what we want to do is to start changing how we pay providers. And we want to start rewarding providers on value-based schemes to say that if you offer better outcomes to the patients that we send to you, we are happy to pay you more than what you would have got on traditional models. So we're looking at how do we actually increase the cost, increase the price for those that actually deliver higher results, and at the same time, how do we actually penalize those who are not achieving, either by reducing volumes or ultimately reducing pricing going forward. So I'll pause there, go back to the panel, but looking forward to discussing this more with you.
Thank you. Thank you, Mark. Jad, we'll go back to you. We are seeing pharmacies opening primary care centers, insurance opening primary care centers as well, and tech companies going to the healthcare. What kind of other trends that you are seeing, and what really will survive and what will die?
We're seeing new entrants building capacity, whether it's pharmacies entering into primary care, insurance companies entering primary care. What do you see in terms of dynamics and how that's contributing to the sector?
Typically, can you hear me? Hello, yeah. Typically, my predictions are always wrong, so this one should not be different. But when you look at these dynamics, you would expect to see more and more entrance into the primary care and ideally emergence of feeder networks that you would expect the large hospital group will just pounce on to integrate, and you'll start seeing some integration. I've been predicting this for the last decade and I haven't seen it. So look, this is what the logical behavior of the market should be. However, if you take into consideration all the digital tools that are coming, we should expect a disruption that, frankly, I cannot predict. And with AI giving access to patients to the same level of expertise that the doctor has today, who knows where we will be in the next 3 to 5 years. Very frankly, I cannot make any predictions on that front, but I'm sure Dr. Ibrahim and Mark must have their own perspective on that.
Dr. Ibrahim?
Today I think we have to look at the model of care. So one of the main transformation elements that considered by the Ministry of Health is to have the model of care. And that's why we should know exactly proper utilization of the primary care centers, where even Mark, I think, showed in his presentation that value-based healthcare should be focused on the healthcare transformation process. So the same thing, I think, we should look at exactly the gaps that we been defined clearly. Is it in primary care health sectors or even in specialized areas, not only as a general hospitals today. Today, I think where is one of the plans that we are looking for it is that to have the capacity planning for all health sectors. So we need to look at it by regions and by areas geographically. So as I said at the beginning, one of the main objectives also for the transformations that we shift from focusing on health institutions to focus on a person himself. So that's the center of concerns that we should look at. And based on that, I think what has been mentioned by Jad, that he already defined exactly, looking to define the gaps where we can see this health sector. The same thing with the Mark presentation, that we should, what exactly model of care that we should focus at the transformation process.
Excellent. Mark, sometimes the model of care is nice and primary care is, everyone is promoting primary care, but we have so many investors that open primary care, but the insurance does not really reimburse them fairly, so they will not really survive over time.
Yeah, no, I think it's a fantastic question. And if we look at the model of care, where we are today, it's an evolution of the market, right? And the market is a function of the consumers, so the patients. It's a function of the suppliers, in this case, the hospital systems, and it's a function of the payers going forward. And if you look exactly as you said, if the reimbursement for a primary care visit by insurance is 20 Saudi riyals, there is no business case to actually go ahead and do that. So I think we are at fault of building the dynamics that we see, in addition to the incentives, et cetera, that needed to have been created in order to catalyze those markets. Now, today, as a result of that, what we are seeing is there is diminishing returns on healthcare expenditure. We are paying more. Every year, the price of insurance is going up, the cost of care is going up, but our population is not getting healthier, we're not living longer, our chronic diseases are not being managed better, so we are not making significant returns there. I think what has happened today is we are really at a critical point where we're now starting to see the cost of healthcare becoming a significant deterrent for people growing their businesses, hiring people, et cetera. At this point, we are very motivated to try to start bending that cost curve down. So we are relooking at our pricing structure. As we said, that includes incentives towards primary care. It will include rewarding those providers that have better outcomes than their peers in order to try to create consolidation there. And we are also investing ourselves to say that we want to be personally accountable for trying to improve the health and wellness of people that sign up for us as a health plan. That means that we may consider programs like population health management, primary care, prevention, But by no means would our motivation be to own that and have 100% of the market share there. We want to catalyze the system to transform and to start thinking about more appropriate ways to treat people when more appropriate ways can actually be executed. But you're absolutely right. I think one of the challenges has been that the incentives and the rewards were not there to actually motivate people to create those change in behaviors.
Thank you. عندنا وقت يمكن لسؤالين من الجمهور لو الأخوان بس أخ فهد. إذا في حد عنده سؤال أخت الجوهر. معك. هنا عمر.
السلام عليكم يعطيكم العافية. الجوهر العفالق. I'm from private sector. I see mashallah great alignments between Ministry of Health and insurance companies. So I would like to clarify for me if there is future products that serve well-being before the patient going to the hospital, since it's more of healthcare family, and before you go to the hospital, you need to go to the, what do you call the small centers, sorry? Yeah, before even, preventive and even well-being, يعني. So is there any alignment between insurance company or sector and Ministry of Health? Because I see great alignment, but until now I don't see products in the market as in Emirates. I see some products in Emirates that Ministry of Health funding, for example, even gym subscriptions.
Yeah.
So Mark, they have an interesting program in Tawniyah. Maybe Mark can elaborate.
Yeah, absolutely. And when I said that our commitment was to say that when you sign up to us as a health plan, we are a wellness and health partner to you, means that we need to make investments to fulfill that commitment. One of the things that we've done is we've actually brought to Saudi the world's leading population health management program, which is Vitality. So we have a program and a partnership with Vitality, which is a insurance company out of South Africa. And essentially what they do is they have a platform that ultimately creates behavioral change for people who decide to be highly active and engaged with it. And ultimately what it does is it tries to understand what we identify as the most common drivers of poor health. So social determinants of health when it comes to your diet, your habits like smoking, exercise, and food intake. And what we do is we monitor those things through, for example, steps for people who log. And what we do is we create the incentives for you to actually start being healthier over a period of time. So if you start to become more active and take more steps, we give you rewards. So we give you movie tickets, we'll give you free coffees, we'll give you vouchers to the diet center, and all you have to do is participate and engage in these programs. And what we found is that we have about 100,000 members today that are on that. Interestingly enough, 90% of those are actively engaged. So those who do download it actually see a lot of benefit from it. And those individuals have lower claims, they tend to have a healthier overall status, and they tend to stay with us for a longer period of time. So this is a shared value model where we actually do well as an insurance company by ensuring that you are doing well by taking care of your health. So we're investing in those programs. I think ultimately what needs to happen is there needs to be more behavior change within the market. So we need to create more awareness, and that's obviously in collaboration with the Ministry of Health, with other regulators, to empower people to start using these tools going forward. But absolutely, I think we do think about that quite a bit, and I'm sure as the model of care with MOH, there's a tremendous amount of push towards living well and staying healthy.
Excellent, thank you. في سؤال ثاني؟ بس جاك جوهر هنا.
Assalamu alaikum. Dr. Hamdan from Tawariyat. I'd like to thank the panel for the great insight of the current transformation, specifically Dr. Ibrahim Al-Umar. I've been in the private sector for the past 15 years, and we have experienced multiple difficulties and roadblockers when we enter the market. Thankfully, those things have changed tremendously over the past years.
بس دقيقة يمكن أتوقع ما نسمع زين ولا؟ بس ممكن لو احنا ما نسمعكم، الظاهر انتم تسمعونا واحنا ما نسمعكم.
هنا ما طلع الصوت؟
ممكن بس لا احنا ما نسمع.
انتم ما تسمعون.
المايك صار كل السماعات عليكم.
طيب اوكي كذا كويس؟
كذا زين.
يلا يعطيك العافية. طيب I would like to thank the panel for the great insight. Specifically Dr. Al-Umar for the progression of the transformation of the medical care. I've been in the private sector over the past 15 years, and I've seen a tremendous work that goes into easing up the process and eliminating multiple roadblockers, specifically in the regulatory side of the city, civil defense, and getting the licensing. One of my concerns, specifically that we have the insurance team around, is if we do have a sort of a mechanism or a mechanic that will allow any new provider who gets into the market into plugging in and play a sort of a standardized billing format that will be applied for any new facilities. For example, if someone is entering the market with a new hospital, and probably Mr. Al-Musa can assist us in that too, if you open up a new facility, it will take you, let's say, 6 months in order to get your licensing, and this has been reduced from the previous 2 years when I opened our first facilities 15 years ago. But now, when we try to get into the insurance patient, we will need another 6 months and road shop between the multiple insurance companies, even if you have a facility that you own. My suggestion, if there is any mechanism where we can standardize a way of billing or insurance that will grant the relationship between the provider and the insurance company. So there will be no delay in getting the patients on board, and there will be no much of a conflict between us and the insurance companies. Thank you.
أعتقد السؤال الأول دكتور إبراهيم للlicensing will process إنه and I think 6 months if you are lucky. I think يعني 6 months if you.
Sam?
I go 6 months to license a hospital if you are really lucky. It will take you more, but I think we just discussed this with Dr. Ibrahim. Initiatives to ease the licensing process and the journey and the transformation that you do.
إذا فهمت سؤالك سؤال مشقين، الأول إنك تتكلم على البروسيس حق اللايسنينج.
لا ما أتكلم عن licensing. I'm happy with the licensing, by the way. I'm very happy with the licensing process. What I'm suggesting is basically to change the mechanism of the relationship between the medical facilities and the insurance company. For example, you open up a hospital and you try to contract with the Ta'awuniya, with Buba, with someone else. Everyone has their own price list. It will take a humongous time. All of these facilities, I would suggest a standardized format of billing system that applies to each facility according to the consultant level, to the level, something like that, in order for us not to delay the cash inflow for any new organizations. Thank you.
Yeah, no, it's a fantastic question, and I think if we talk about catalyzing this new model of care, including prevention, primary care, digital, so on, there's going to be a proliferation of providers, right? So many new providers will enter the market, and therefore we need to be able to hook them into the infrastructure in a lot easier way, right? Connecting payers with providers, licensing, all of those things need to be catalyzed. There is this mega project called Nafis, which I'm sure you've heard of it, under the Council of Health Insurance. Essentially what they are doing is they are rolling out a new health insurance bus, which is the ultimate infrastructure on which everything insurance related will run. So claims will run from providers to payers to TPAs, reconciliation processes will happen there, there'll be oversight, KPIs, better governance. And I think with the addition of Nafis, they aim to bring a lot of standardization around the revenue cycle management process in order to enable providers to connect to the grid in a lot sooner and quicker way. So I think with the advent of Nafis, and they are already very well into testing, I think there's ultimately more than 10 million claims that have passed through it. I think that should facilitate this interoperability challenges that you're discussing. CHI is also working hard around other things, so creating standardized contracts between payers and providers such that not every payer and provider has to enter a negotiation. There are standard terms. They're working on illustrative price lists, so they're trying to work on those things as well. So I think those tools are coming. However, it will take a significant period of time in order to organize the overall ecosystem. But I'm sure CHI probably has more details at this point than I do.
Thank you.
Thank you. في سؤال أخير بس تفضل أبو عبد العزيز.
السلام عليكم. أخوكم محمد العفالق, الchairman of الأحساء Health Cluster. Thank you for participating on this session. I'm happy to hear what's mentioned. I have a concern regarding the cost of insurance or reinsurance is going up periodically. Is there any plan regarding the chronic diseases that we encourage the people to go for periodical check and also for primary care or routine checkup on periodical period, so the people will be aware of chronic diseases in early stage, and this could be supported by the insurance company, so that will encourage the people to do that, and then probably will reduce the cost because people will be aware of chronic diseases in early stage. Thank you.
So inflation of insurance, it's an annual now, it's almost 10 to 15%.
Sure.
If you want to subscribe to a new policy, it's a 10 to 15% increase.
Yeah, absolutely. So let me share maybe a bit the dynamics around how insurance is priced. The benefit package, which we provide to our employers who purchase, is defined by the Council of Health Insurance. Now, the benefit package tends to be quite large in terms of the minimum amount of benefits that you can provide. That ultimately results in very little room for us to differentiate on the product side. So what ultimately happens is, to some degree, all the insurance products are identical, with some variation around some network, around some co-payments, around customer service, so on and so forth. However, that ultimately results in a commodity market where the lowest price tends to get market share going forward. That creates a significant amount of compression on our margins. So by definition, we price our products at a very low margin. So ultimately, what we're seeing in the market is, as the cost of healthcare goes up, because the cost of consumables have gone up, the salaries of individuals have gone up, the population is getting sicker, we are maintaining our margins. Our margins are very thin. However, the base cost has gone up. So as a result of that, we have to pass that cost on to the employers in terms of higher premiums in the next year. Now, where we can intervene is trying to reduce the low-value care, the care that we feel is being provided that actually doesn't result in outcomes. And the way that we need to do that is through partnership with providers. And we have to work closely with providers and to say, if you provide better quality care, we're going to push our patients to you, and we're going to tell them all about that. And we're going to give you higher volumes, and you'll actually do better as a result of you having better outcomes. So the way to change the inflationary pressure when it comes to the premiums is for providers and for insurance companies to work closer together to try to really identify where to solve these problems, in addition to creating lower cost options where appropriate, prevention, primary care, so on and so forth. So it's a complex challenge. But rest assured, our margins actually haven't grown as we put our prices up. We are ultimately very downstream of where we see the inflation actually happen. Alec, maybe do you want to comment on that?
Well, when you ask the regulators, they say the insurance is increasing the prices, and when you ask the insurance, they say the regulators is actually the cause of it. And everyone is blaming the providers at the end of the day. So it's not really clear, but I think there is a cost of essential benefits for sure. Over time, I think it will be stabilized because there is no additional benefits that will be added in the coming 2-3 years. We have a very generous benefits list compared to the GCC market. But I think over time, maybe it will be stabilized in the coming 2-3 years. في نهاية الجلسة حابين حقيقة نشكر الجميع على حضورهم، وهذا الحوار الرائع والمتحدثين الأخوان اللي تكبدوا عناء السفر من مختلف المدن في المملكة وخارج المملكة. هذا القطاع الواعد الصحي اللي يمثل الآن يخلق ما يقارب 20,000 فرصة في القطاع الخاص ومثلها في القطاع الحكومي، ما يزيد عن 120,000 تنويم في القطاع الصحي، نصفها تقريبا في الخاص ونصفها في الحكومي، وأيضا ما يزيد عن 8 مليون زيارة عيادات في السنة الماضية، نصفها أيضا في القطاع الخاص ونصفها في الحكومي. هناك فرصة كبيرة في القطاع الخاص، هناك فرصة أكبر أيضا في القطاع العام مع التحول الصحي في شركة الصحة القابضة، وبإذن الله مطلعين إن شاء الله نموذج مثالي في الأحساء، بما أنها موقعها الجغرافي وموقعها أيضا الذي يؤهلها أن تكون واحة صحية بإذن الله. شكرا جميعا لكم، ومتطلعين إن شاء الله لقاءكم في السنوات القادمة.